as a fertility NP, I did freeze my eggs. I feel like when I first got this job, I would look around and see patients that were my age. And at the time, that was 26, 27, 28. And I remember looking at the embryologist saying, hey, why are these people doing egg freezing? Or why are they doing infertility treatments? And he answered me and said, some people have diminished ovarian reserve, some people have blocked tubes, some people, and he listed off all the reasons. And it was a little bit scary because these people were my age, or a lot of them were. And so an incentive at our company at the time was if you had worked there a year, that you can do a free egg freezing cycle. And so for me, it was like, I feel like I kind of worked paranoid for a year because I'm like, oh my gosh, all these people are young and they have a low reserve. And I guess I just never, I feel like at your physical, nobody talks to you about these things. And so this was kind of an eye opener. So once I hit a year, I checked my ovarian reserve and I decided to go for it. And so really, again, from experience, I think seeing kind of the sooner you do things, the better. That was my reasoning for doing it when I did at 28. So as far as my personal experience, I think one thing that surprised me with the medications, so my cousin who lives in Denver actually came down to stay with me, and she froze her eggs at CNY where I work because she wanted to do it, and it was special for her because she got to see me to do it. And I remember giving her the Menopur injections and her telling me, this burns. And I would always tell her, okay, woman up, you're fine. And then when I finally had to do it, the medications were all fine. And then I got to the Menopur and I just forgot about that really. And I started injecting it and it kind of felt like a bee sting at first. And I was like, oh, okay, she was not like being a wimp. And so then I was on Reddit or Google trying to I guess, okay, what's a trick that's going to make this not hurt? And something I did discover, which is a tip for people going through IVF or egg freezing, is that if you mix the Menopur and you leave it out for 30 minutes, and then you ice your injection site, which the Dandi belt would be really handy for this while you're prepping the Menopur or doing other things. By the time 30 minutes is up, you can take the Dandi belt off or the ice pack and do your injection. And if you inject it super slow, the sting is almost none. And now I feel bad because I didn't know this for my cousin, but I do know it for you guys now because I've been through it. And so that was a little bit surprising about the medications, but now I know how to fix it. So I did do 2 egg freezing cycles. Another kind of surprise is that, you see people going through infertility treatments or IVF and you think, okay, well, I don't have infertility, so this process isn't going to be as stressful for me. And then I remember looking at my follicles on ultrasound thinking, I could get more than this. I'm going to wait a month. And you think, why am I so worried about the number or how many I can get when you may not, one, you may not even need these, and 2, you don't have infertility that you know of. And so I think it's surprising when you go through it that it does start to become oh my gosh, could I get more? Should I do another cycle? And it becomes this kind of mind game that you hear patients talk about and you don't think that you'll experience. And I think that was kind of eye-opening. But yes, I did decide to do another egg freezing process. I had a number in my head that I wanted to get to. I got that number retrieved, but not all of them were mature. So I said, okay, I'm going to do another cycle. And I did, and it got me to a point where I was comfortable with. And I think the cool part about freezing your own eggs is, people have said, how long are you going to keep them frozen for if you don't need them? I don't know. For me, I think I would save them in case I had a daughter someday that, for some reason went into premature menopause or who knows. But that way, if she ever wanted to have a child and needed somebody else's eggs, there would be mine that she could use. So I think that's another cool reason to egg freeze and to save your eggs longer than you think you may need them in case somebody else that you possibly may want to donate them to needs them as well. So how do you prepare for egg freezing? And can you drink? Can you exercise during the process? So usually, I guess, let's see, we'll start with one. How do you prepare? So supplements, the basics, is a good prenatal vitamin. And so any prenatal usually will work. CoQ10 is another good one. I usually have people take about 600 milligrams a day. Occasionally, it's not a supplement, but if I have someone with PCOS, I'll put them on metformin to help with egg quality as well, or any insulin sensitivity that may or may not be going on. Really, I read it starts with the egg. And so the list of supplements in there are kind of what I go by. I looked up all of the stuff from that book. And so now I send people a list at every egg freezing consult about, hey, these are the supplements that are recommended for egg quality, CoQ10 and a prenatal being the main things. As far as drinking, you can drink during the process while doing medication or while taking medications. That's fine. The only thing I would say is maybe stop drinking about 24 hours before your egg retrieval, right? Because alcohol can thin your blood and we don't want you to be bleeding. But otherwise, drinking during this process is fine. Exercise. So exercise, usually I'll say, hey, once you're about a week into stimulation, so about a week into taking the injectable medications, take it easy. So you can still weight lift, you can still walk, you can still do yoga, but nothing jarring or no inversion. So like no downward dog in yoga. I wouldn't run or do CrossFit. And the reason is because those ovaries get really big. And so sometimes if you're upside down or if you're jogging, then those ovaries can twist on themselves and cause what's called ovarian torsion, and that's an emergency. And so we want to avoid that. I don't think I've ever seen it happen, knock on wood, but that's something we like to avoid. And then you can resume normal exercise again once your period returns after the egg retrieval. And then the other thing is intercourse during stims. I get asked about that a lot. Same kind of thing. So once you're about a week in, no intercourse, just because we don't want the ovaries to twist. And the other reason is because you're going to have a ton of eggs in there that are mature. And then when we trigger you to ovulate, if you were to have intercourse and not have any sort of contraception, you could get pregnant, which is really bad because you could have up to or around 15 eggs that are mature. And that could probably get you a reality TV show, or you're going to have to kind of make some hard decisions because that's a high order multiple pregnancy and can be really dangerous. And so those are the things that we really kind of advise against during this process. I would say if you are interested at all in egg freezing, to start the conversation. I guess the first thing is if you get anything out of this, please go check your AMH. Go to your primary care provider, go to your OBGYN, come see one of us, and get your AMH checked. It's a simple blood test and it's easy. The only thing I will say is make sure that you have somebody to follow up with that knows how to give the proper counseling for it. So whether that be a fertility specialist or an OBGYN that has been well kind of versed on AMH, that's the first thing. And the other thing is to schedule a consult. So, scheduling a consult by no means that you have to egg freeze. And so I tell people this all the time. They'll come in and say, well, I don't know if I really want this consult because I'm not sure if I want to move forward. And so my advice always is, let's get a history. Let's talk about your cycles. And I'll order testing. My advice to everyone would be to do the testing and then from there make the decision, because you may do the testing and say, oh my gosh, my AMH is a lot lower than I expected it to be. I'm definitely going to move forward with this, or I'm going to start saving my money so that next year or the year after I can do this. Or it may be higher and you may say, okay, I have time. And so there's kind of different ways to look at it. I would schedule a consult and kind of start there. because it doesn't mean you have to, but you can't make decisions on information you don't know. And so that's the first step, is getting information, learning about your ovarian reserve, and then kind of going from there.